Okay, hi, my name is Alicia Loa, and I will start with my first scenario. Nurse orientee struggling with titrating drug doses, weakness and types of learning. Find out about the cognitive learning. The nurse orientee may be struggling with understanding core concepts related to pharmacokinetics and pharmacodynamics. This involves understanding how drugs work in the body and the relationship between dosage and physiological effect. Next would be if they have difficulty in performing the task associated with drug titration, such as calculating the correct dosage or adjusting the infusion rates based on patient data. Thirdly, the orientee might have difficulty in analyzing theoretical knowledge to real world scenarios, including analyzing patient data and making decisions on drug doses. Additional information I would collect would be their educational background, understand the orientee's prior education and experience with pharmacology and dosage calculations. I would go over with them to see where their baseline is with their dosage calculations, to see if they're understanding how to break down and convert their calculations. Then I would find out their assessment baseline of knowledge. I would evaluate their current understanding of drug being titrated and what physiological data they are interpreting. Then I would find out their learning style. I'll identify their preferred learning style to tailor their teaching methods, such as if they're visual learners, auditorial learners, or kinetic learners. Then I would observe the orientee in simulation of real life scenarios to identify specific areas of difficulty and ask questions and get feedback from the orientee about what aspects they find challenging and confusion, and take time to work on each and every one of those areas that they may be struggling with. Second scenario would be counseling a failing student, nursing student. The self-efficacy theory approach would enhance the student's belief in their capacity to succeed. Use positive reinforcement by highlighting past success in strong areas. Encourage setting achievable goals. Provide constructive feedback and other support to build confidence. I would introduce methods to success such as peer mentoring or stories of overcoming similar challenges to improve the student's self-efficacy. Next, I would analyze the reason the student believes they are failing. I would discuss with the student their beliefs about what causes their success or failure, identify whether they attribute this to internal factors such as their effort, ability, or external factors such as the task is difficult, and other things that we could go over as well. I would also help with maladaptive attributions, such as when the orientee states, "I'm bad at this," we could turn it around with a positive thought and say, "Well, I didn't get it right this time around, but I will practice and do better." And then the third scenario, teaching with social cognitive theory. I would encourage the preceptee to learn about observing others, demonstrating procedures, and offering opportunities to practice skills in a controlled environment. In controlled environments, I would demonstrate desirable behaviors and skills such as patient interaction and clinical procedures. Provide role models who display competence and proper professional behavior. But also encourage the preceptee to set personal learning goals, monitor their own progress, and engage in self-assessment to foster independent learning and problem solving. Also acknowledge that learning is influenced by the environment, personal factors, and behavior. I would create a supportive learning environment that adapts to the preceptor's needs and encourages engagement. By using these strategies, I can create a structured and supportive environment that enhances learning and skill acquisition for the orientee under my guidance, and hope for positive outcomes so that the orientee can feel relaxed and be able to learn in a less stressful environment. Because it is scary as a student to go out and to learn these new skills and feel confident about it. So I would reinforce this by giving them the opportunity to practice as many as times as they need till they feel confident about doing each and every skill that they need to learn. And that is going to do it for me. This is the end of my video. And have a good evening.